now I will be transferring a patient from a bed to a wheelchair, and the goal of this procedure is for the patient or the transfer to be accomplished without any injury to the patient and to the nurse, and the patient is free from any complications in relation to immobility. Usually, we need equipment like chair or a wheelchair, a gait belt, the stand assist device if available or based on the assessment, additional nurse or staff to assist if it is available and depending on the patient's condition, a blanket and non-sterile gloves or other PPE if it is indicated and necessary. Now for the implementation, I will review the medical record and the nursing plan of care for the patients or for any conditions that may influence the patient's ability to move and to be positioned. And then I will assess for any tubes, IV lines, incisions, and other equipments that may alter the process of positioning. And from that, I will identify any movement limitations. And then I will perform hand hygiene and put on PPE if it is necessary or indicated. And then I will introduce myself to the patient, verify my patient's identity, and explain the procedure to the patient. Good day, sir. I'm Cheryl Po, your nurse for today. May I know your name? Okay, how old are you na po? Okay, for today po, I will be transferring you po from your bed to a wheelchair po, sir. Would that be okay for you? Okay, thank you, sir. And then I will move any equipment to make room for the chair, and I will close the curtains around the bed and close the door of the room for the patient's privacy. And then after that, I will place the bed or the height of the bed at the lowest position and adjust the head of the bed at a sitting position or as high as the patient can tolerate. And then I will make sure that the brakes of the bed are locked, and then I will position the chair or the wheelchair on the side of the bed, and I will also make sure that the brakes of the wheelchair are locked. Okay. And then after that, I will now encourage the use of stand assist device by my patient if it is available or necessary to help it's either freestanding or attached on the side of the bed to help the patient to move on the side and the side lying position facing the side of the bed in which the patient will sit. And then after that, I will lower the rails of the bed and stand near the patient's hip with my feet spread at the shoulder width and one foot is slightly in front of the other. And then I will encourage my patient again to use stand assist device if it is available and assist my patient to sit up in the side of the bed. So I will ask my patient to swing his legs over the side of the bed later. Okay, sir, isa-side ko lang po kayo, okay? Just move your arms across your chest and then we will bend your leg. And then on my count po, 1, 2, 3. Side ko po kayo, okay, sir? 1, 2, 3. Okay, sir, very good. Now, I will ask my patient to swing his leg, as I said, over the side of the bed, and then at the same time I will pivot back on the back leg to lift the patient's trunk and shoulder, and I will keep my back straight and avoid twisting. Okay, sir? I want you to swing your legs on the side of the bed, okay? 1, 2, 3. Very good. And then I will stand in front of my patient and assess for any balance problems and for any complaints of dizziness. Okay, sir, nahihilo po ba kayo? Okay lang po yung pakiramdam niya? Thank you, sir. And then I will allow my patient to dangle his legs for a few minutes before the break. And then I will assist my patient to put on rope if necessary or available and the non-skid footwear. Please, sir, suot mo muna po ito. Comfortable po kayo. And then after that, I will wrap the gate belt around the patient's waist based on the assessed need and per facility policy. But in my case, I will be using my arms to lift my patient. And then I will stand in front of my patient with my feet spread over at the shoulder width, and one foot is slightly in front of the other foot. And then I will ask my patient to slide his buttocks over the edge of the bed until the foot touches the floor. Okay, sir, kaya mo po bang mag-move ng forward para po mag-touch yung floor? Okay, very good po. And then I will position myself as close as possible to the patient with my foot position on the outside of my patient's foot. So if I have an assistant nurse, I will have my assistant assume a similar position. And then I will encourage my patient to make use of stand assist device if it is available. And if it is necessary, if I have a assistant nurse, I will have the assistant nurse to grasp the gate belt opposite side, and then I will use the gate belt to lift or to assist the patient to stand up. So I will rock back and forth. I will rock back and forth and count on 3. And then on the count of 3, I will use my legs to help the patient or to help raise the patient in a standing position. So if it is necessary, I will use the front of my knees to brace the patient's weak extremities as he stands, and then I will assess for any balance problem and then the leg strength. And if the patient is not steady enough, I will put him back to the bed. So I will now proceed on the lifting my patient. Okay, hawak ko kayo, sir. Okay. 1, 2, 3. Iangat ko na po kayo, sir. Okay, sir. And then I will pivot on my back leg and assist the patient in turning in until the patient can feel the wheelchair against his leg. Then I will ask the patient to use an arm to move or to steady himself on the arm of the wheelchair. Okay, sir, use your arm to move. Okay, sir. And then during the procedure, I as the patient steady himself using his arm while slowly lowering himself in a sitting position, I am continuing to flex or to brace my front knee against my patient's knee, and then I'm continuing to assist him by wrapping my arm around him. And then as I did the procedure, I am flexing my hips and my knees in assisting the patient. Now, I will assess for the proper alignment or the alignment of the patient in the wheelchair. Okay, sir, okay lang po ba kayo? And then, I can remove the gate belt or I can leave it in place to use for the return transfer depending on the comfortability of the patient. And then I will put on a blanket. And then I will make sure that the call bell and other necessary items are within the patient's or within easy reach. And then after that, I will clean transfer aids as per facility policy. If it is not included, that it is for single patient use only. And then I will remove PPE or non-sterile gloves if I have worn one, and I will perform hand hygiene. So for the evaluation, the transfer is accomplished. The transfer of the patient from the bed to the wheelchair is accomplished without any injury to the nurse or to the patient, and the patient is free from any signs or symptoms of problems or complications in relation to mobility. And then for the documentation, I will document the activity, the length of time the patient sat on the wheelchair, the other pertinent observations, and the patient's tolerance and reaction to the activity. And I will document the use of transfer aids and the number of staff required for the transfer. So that's all for the transferring of the patient from the bed to a wheelchair. Thank you.